I also had my first physical recently in 10 years. Has anyone else ever had a fat doctor tell them they were overweight? I had that happen. A very fat doctor was like, technically, 6'2", 200 pounds. That's overweight. It was like, well, you're overweight. And I swear to God, his response was, oh yeah, big time. He's like, yeah, I got a plate of wings waiting for me outside. I just got to tell you the numbers, that's all. It's not a judgment. Healthcare is a big political issue now. I'm not a political comedian. I don't know much about that or what's happening. I know Obama's a Nazi. I know that. I've seen the town halls. They've convinced me. Which, by the way, being the first black president, extremely impressive. Being the first black Nazi, way more groundbreaking. They have really strict rules on that shit. Kudos, Barack. What I do know is how someone without insurance is treated when he gets sick. I had pneumonia a year ago. I had like 103 degreever. I've got no time to waste. I have to combine all the words. 103 degree fever for like 3 days, which is bad. And so I went to the ER, and it became very clear that they didn't really care that much about curing me. When I swear to God, the doctors, they'll ask you questions about your lifestyle, what you've been doing lately, to try to figure out what's wrong with you. I swear to God, the doctor asked me verbatim, have you been upstate drinking any pond water? It's like, is that really on your list? Is that a question? Or did some other doctor just dare you to ask an uninsured person that today? And then she did it, went around the curve, was just like, yes, I did it, totally. He bought it. He thought we were trying to cure him. No, not at all. And she so knew she wasn't going to cure me, because she did nothing to help, that she gave me a referral to like a cheaper place to go for when I would get sick the next day, which I did. So I went, and there's a place called Astoria Family Health Associates, plug. I was greeted by a 300-pound nurse named Calvin. And Calvin went to take my heart rate, which fairly basic medical move. Usually when you do that, you count for 6 seconds, multiply by 10, you get your beats per minute. Calvin tried to count for a full minute, and lost count around second 45. And then he tried again, tried the multiplying thing, wrote down something, left the room. The doctor came into the room after that, was like, hey, Mr. McCaffrey, how are you? Picked up the file, looked into it, looked horrified. Looked at me, looked back at the file, and went, oh, Calvin must have multiplied wrong. Calvin wrote down in his official file that I had a resting heart rate of 240 beats a minute. And he wasn't even worried about it. He wrote it down and was like, see you in an hour, and just walked out of the room. If he actually believed those numbers, we all make math mistakes, that's fine. But if he believed those numbers, I just would have liked to have seen a little more concern. Or I would have liked to have gotten the correct diagnosis from there, which would have been, Mr. McCaffrey, the doctor will be in to see you in a few minutes, but before then, you will explode. So be ready.